Good evening, everybody. Welcome to our Womb Care Clinic webinars. As Womb Care Clinic, we host a series of webinars at least on a minimum once a month, where we fulfill our mission of having well-educated women to help women navigate through their journey of life through knowledge. And we believe through our webinar, we get to share that knowledge and we get to allow women a chance to express themselves, ask questions that they would like to ask. That way, they better understand their bodies. My name is Paul Mwemba Musoba. I'm a consultant obstetrician and gynecologist at Womb Care Clinic. I'm also a fistula surgeon and I'm a fertility fellow. On this week's webinar, we'll be talking about urinary tract infections in pregnancy or UTIs in pregnancy. I hope I am audible. Can somebody please confirm if I'm audible or not?
You are audible. We're able to hear you loud and clear.
All right, thank you very much, Barbara. All right. So remember, this session is for learning and awareness purposes only. For personal care, please consult your nearest healthcare provider. That way, a treatment plan can be tailored towards you. Below is my presentation layout. I'll start with a common case that I get to see in my gynecological clinic. You have a 32-year-old female in her first pregnancy at about 18 weeks, that is 4 months and 2 weeks, who comes in complaining of frequent urination, even waking up at night. She wakes up several times. She has pain when passing urine, which is associated with a backache. She reports that she doesn't have any fevers, she doesn't have any chills, however, is having this pain during urination. She has been told by other people that have been pregnant before and others who are doctors in society, virtue of experience, to say this is part and parcel of a normal pregnancy. So this particular case is a case that you get to see quite often for women to come through. And the thing about these urinary symptoms is that they usually overlap with what are the normal changes that a woman can experience during pregnancy. As pregnancy gets bigger, you find that women will experience frequency in urination. Sometimes they'll wake up at night a couple of times. However, they will not experience any pain during this urination. Therefore, pain is always a danger sign that one should look out for. So what is a urinary tract infection? Basically, a urinary tract infection is an infection that affects your urinary system. And if we look at your urinary system, we're talking about your kidneys, which acts as the filter of blood and bad products out of the blood, converts it into urine, which pass through your ureters. So your kidney and your ureter form what we call the upper urinary tract. Whilst when it comes to your bladder, which is the main storage part of urine, and the urethra, the passage through which urine leaves the body, those are what you call your lower urinary tract. So if you look at urinary tract infection, we're simply talking about an infection with bacteria that can either affect your lower urinary tract, which is your urethra and bladder, or your upper urinary tract, which is your ureters and your kidneys. So there are three forms of urinary infections. There is what we call asymptomatic bacteriuria, which is the presence of bacteria in the urine. However, one does not experience any side effects. Then there is what you call cystitis. I'm sure a lot of us have heard about cystitis. Sometimes there's even something that is called honeymoon cystitis that is seen in couples that just get married. So this is an inflammation of the bladder itself and can lead to urinary symptoms. And then there is a more deadly version of it, which is pyelonephritis, which is an infection that involves the kidney, which is part of the upper urinary tract. So a few facts about UTI in pregnancy. Number one, urinary tract infections affect about 2 to 15% of pregnancies, which is quite a high number. And if you look at these urinary tract, asymptomatic bacteriuria, which is just the presence of bacteria without any symptoms, affects 2 to 10% of pregnancies. Through science, we've seen that patients that have asymptomatic bacteriuria that is not treated or screened has got a very high progression into cystitis, which is infection of the bladder, and a pyelonephritis, which is infection of the kidneys. Acute cystitis occurs in about 1 to 2% of pregnancies, whilst acute pyelonephritis, which is the deadlier form of this urinary infection, affects 1 to 2% of pregnant patients. And you find that with pyelonephritis, it usually occurs in the second trimester. I'll explain why as we go on. And the major cause of these urinary infections is a bacteria known as Escherichia coli, which is found in about 70 to 80% of all urinary tract infections. So why are UTIs so common in pregnancy? If you look at the picture on the right, you've got a normal woman with her organs in the right place, if I can put it that way. And then you've got this expansion that begins to happen when a woman gets pregnant. So when a woman gets pregnant, one of the first things that changes, and this is something that also happens with your menstrual cycle, is that you've got a very high surge of a hormone called progesterone. So progesterone is the hormone of pregnancy, more or less. It's the one that keeps the pregnancy going. It's the one that keeps the uterus quiet and calm. The way it does that is by causing the relaxation of muscles. And the idea is that as these muscles relax, it allows the uterus to grow, and it also prevents you from going into preterm labor. However, the effect of progesterone is not just on the uterus alone. Since it relaxes muscles, you find that it's got the same effect on the bladder, it's got the same effect on the ureters as well, which carry urine from the kidneys to the bladder. And because of this relaxing effect that it has, it causes urine to stay a little bit longer within the bladder. It causes a patient not to fully be able to empty their bladder even when they go to pee. And then it causes a urinary reflux where urine goes back up into the ureters when it's supposed to be shunted in one particular direction. So there's that hormonal change that happens because of the effects of progesterone. Then there are the physiological changes, and these are your body's way of adapting to pregnancy. These physiological changes include there is an increase in the amount of blood that is circulated in this pregnant woman. And the major increase is so that it can supply both the mother and the growing baby. So with this increase in blood that is circulating throughout her system, there's also an increased flow that is going to the kidneys as well. So meaning there is an increase in the production of urine that the mother is going to be experiencing throughout pregnancy. And hence there's this frequency, which is the need to urinate pretty often that happens to this particular patient. And you find that with this increased blood flow, with this increased frequency, there is also sort of a filtering out of a number of agents that are supposed to be kept within the system just because there's this increase. And these agents that can go into your urine can also provide an environment for bacteria to actually grow. Finally, there are what you call anatomical changes that begin to happen to this mother. And the picture on the right clearly shows us these anatomical changes where the uterus is getting bigger from being this little pear-shaped to increasing in size significantly, such that it is causing a lot of pressure on both the bladder. It's causing a lot of pressure on the ureters themselves that are carrying urine, and it's causing this amount of pressure. So because of the pressure that the baby causes in this uterus that is expanding, you find that there is sort of some blockages, some reduced flow of urine that happens, and this is more severe on the right side than on the left side. So as the uterus grows bigger, as the baby grows bigger in there, you find that there is compression symptoms, and it can end up compressing the ureter, which is bringing urine from the kidneys to the bladder, and it can also cause pressure on the bladder, causing urine to stay in there. And as I always tell my patients, urine that sits for a period of time, bacteria enjoys that so much. So these anatomical changes, these changes in the physiology, these changes in the hormones are the ones that actually predispose women to developing urinary tract infections in pregnancy. So what are some of the risk factors for developing these UTIs in pregnancy? Number one, a patient that has got a history of a urinary tract infection is already predisposed to having a urinary tract infection. So if a woman was having UTIs before she got pregnant, you find that because of the changes that happen in pregnancy, there is a higher chance of her developing another urinary tract infection. So lifestyle, poor hygiene can contribute to people developing urinary tract infection. Tobacco usage, which lowers one's immunity, can also contribute to developing these urinary tract infections. Lower socioeconomic status has also been shown to be a contributing factor to people developing these urinary tract infections. Diseases such as diabetes, sickle cell, or any kidney-related anomaly can predispose a pregnant woman to developing urinary tract infections. One thing I always tell clients is that bacteria loves sugar. And when it comes to uncontrolled diabetes, where there's this high levels of sugar within your system, you find that bacteria is going to enjoy that. Even as the sugar is passing through your urine, you find that bacteria is going to enjoy that environment and will keep growing. A short urethra, which is something that is anatomical for women, predisposes them to urinary tract infections. Why? Because bacteria has got a shorter passage for it to affect the bladder. And if you look at the anatomy of a woman in particular, you find that the urethra, which is the organ where she passes urine from, the vagina itself, and even the anus, you find that those areas are in such close proximity that bacteria can easily traverse from the rectal area into the vagina, into the urethra. High number of pregnancies has also been shown as a risk factor for women developing these urinary tract infections. And finally, late antenatal booking. So it is important once a woman misses a period, she contacts her healthcare provider so that advice can be given on that particular journey and screening can be done on various infections. So what causes UTI in pregnancy? It is bacterial infection. And like I mentioned earlier, Escherichia coli or E. coli is the most common pathogen that actually causes this urinary tract infection. E. coli is actually a bacteria that is usually found in the gut, that's the intestine, and is found in the fecal flora. That is just the fecal matter itself, that's where you find this E. coli. And that is why when we're talking about prevention of urinary tract infection, some of the good vaginal hygiene practices is for a woman to wipe from front to back and not the other way around, because there's a very high risk of contamination if one wipes from the back coming to the front. What are the symptoms of a UTI? So when it comes to the symptoms of a UTI, it is quite difficult to diagnose a urinary tract infection in pregnancy because sometimes the symptoms overlap with the normal changes that a woman can have in her pregnancy. However, in pregnancy, there is no pain when one is passing urine. So if you start having pain or a burning sensation during urination, that is a sign of an infection or something that is going on in your urinary system. If one starts experiencing blood in urine, that is also a danger sign because there's something that is going on wrong that is causing this blood to be present in urine. Then there are signs of increased urination, which is called frequency, and then the increased urge to pass urine, where once urine just fills up, one needs to rush even after passing urine. Again, they feel like, again, they feel full and then they need to pass urine. Then there is also what we call frequent urination at night. This is something that is common in pregnant women, but you find that if an individual is waking up 3 to 5 times in the night, those are signs that there might be something that is going on in the bladder that is causing it to be hyperactive. Pain around the bladder area or suprapubic area is one of the signs as well and symptoms that an individual can experience if they've got a cystitis or they've got a lower urinary tract infections. When it comes to pyelonephritis, which is simply an infection of the kidney, this means bacteria has moved through the urethra, through the bladder, into the ureters, gone all the way up and affected the kidneys. For this, it's usually a systemic infection which causes a patient to have fever, a patient to have chills, a patient to have flank pain, which is just pain on the sides of the abdomen, patient will have backache, sometimes they'll have nausea, they'll have vomiting, patients might get dehydrated, and if it is not treated, you find that this might end up leading a patient into shock. So, how do we diagnose a UTI in pregnancy? Diagnosis of a UTI in pregnancy is based on number one, the symptoms that a woman presents with. So those symptoms that we talked about on the previous slide, as long as a woman is having those particular symptoms, those are pointers to say there is something that is going on in the urinary system. Urine tests as well is something that you frequently do at a local clinic, even frequently do when you come in for an antenatal evaluation. You find that urine will be tested to see whether there's any bacteria in the urine, there are any nitrates in the urine, which will all be pointing out your urinary infection. Urine may also be obtained for culture, for it to be grown in the lab to see which bag is growing there and to see what treatment will be appropriate. Depending on how severe the symptoms are, blood tests can also be done, and an ultrasound scan can also be done to look at your kidneys in a situation that you have pyelonephritis. And also a scan can be done just to check on your baby to make sure your baby is doing well. So how do you collect this urine? So urine will be asked of you. So the idea in collecting this urine is number one, to have your hand washed before you go and pass urine, to use one hand to separate the labias so that you expose the urethra, which is the area where urine comes out from, to wipe that area. Others say to wipe, others say not to wipe, but that is something that is useful to wipe that area and always from front to back. And then to start urinating. And after when you begin to urinate, once you pass out the first urine, to hold, and then to pass the next urine into a container. So this avoids contamination and helps improve the accuracy of the tests that are to be done. So how do you manage a UTI in pregnancy? Medications are key, antibiotics in particular. However, allow me to mention that right now we're living in a very, very dangerous time. And the major reason why is that a lot of the bacteria that we have right now is developing resistance to antibiotics. So the common antibiotics that used to work on bacteria such as E. coli are failing to work right now. And the major reason is ourselves. A lot of us have been abusing antibiotics quite a lot. Somebody has got a viral infection, such as a flu, which does not require antibiotics. And we go over, we buy the amoxicills, we buy the azithromycin, and we take them. And sometimes we don't even finish the course of the antibiotics. We take them for a day, we feel better, we throw them away. So you find that we're busy just poking at the bacteria, allowing it to adapt to these antibiotics. And in the end, what we're having is like we're having a lot of antimicrobial resistance, where bacteria is becoming resistant to a lot of the antibiotics that we're using. So I urge each and every person to judiciously use antibiotics and only to use antibiotics as prescribed by a clinician. And if you've been prescribed antibiotics, please complete the treatment of the antibiotics. So antibiotic therapy is primary in treating of urinary tract infections in pregnancy. Pain medications can be used. If a patient is having severe abdominal pain, they're having a fever, those can be used. If a patient is vomiting, fluids can also be given to you. So management can either be within the hospital or as an outpatient, depending on how you're feeling. Lifestyle modifications are ones that are very important, and we'll talk about them as preventive measures in one developing these UTIs. So, what are some of the complications that can happen due to a urinary tract infection in pregnancy? Some of the complications that can happen can affect the baby, and they can also affect the mother. In terms of the baby, you find that this infection, if it moves from the urinary system into the general system of a human being, it can lead to a spontaneous miscarriage, which is the loss of the baby before the age when the baby is supposed to be born and survive. It can lead to a preterm delivery, which is delivery before 37 weeks. It can lead to prematurity, which are low birth weight babies. It can also increase the chances of a newborn dying early. Why? Because this infection has gone into the uterus, through the placenta, and has affected the baby in general. In terms of the complications that can happen to the mother, you find that this infection, if not treated, can become a severe infection, something that we classify as sepsis. It can also lead to a shock that comes due to the severe infection itself. It can lead to a breakdown of the red blood cells in one's body, leading to anemia, which is a low hemoglobin. It can also lead to clotting problems, where your blood cannot clot and therefore one continues to bleed. And these are all complications of severe form of infection. If left untreated, you find that these infections can lead to breathing problems, and they can also lead to injury of the kidneys. Others have shown that these infections left untreated can also lead to hypertensive disorders in pregnancy. So, how do you prevent these urinary tract infections in pregnancy? First and foremost, good genital hygiene is very important, both before and after sex during pregnancy. So it is important that there is cleaning that is done in the vaginal area before sex and after sex. Avoid cleaning inside the vaginal area, as this just brings about complications on its own. Passing urine after intercourse is also very important. Sex, quote unquote, is quite traumatic and can lead to some injury in that area, and therefore it is important for a woman to pass urine after intercourse. In terms of hygiene, washing the genital area front to back is cardinal. Why? Because you do not want to introduce infections from the anus area coming to the front. Avoid baths. Why? Because when you're bathing, you find that the woman's private part is exposed in that water, and bacteria that she is washing off is being washed in that area, even in the water that she is sitting. Use of liquid soaps, because bath soaps, which are bars of soap, usually have got the ability to harbor bacteria that might lead to contamination. When one is cleaning, it is important that they clean the urethral area, which is the urination area, first when they're bathing. And finally, it's important to wash one's hand even before using the toilet, as they don't want to contaminate that area. So, urinary tract infections are very common during pregnancy. This is due, number one, to the physiological changes that one's body undergoes, to the anatomical changes as well, due to the growing uterus, due to the baby in there that undergoes to help support this growing baby. Good vaginal habits, early antenatal care can help prevent complications of this infection. Thank you very much for your attention. I'll now open it up for some questions. In case of any questions and anything that we can talk about in terms of urinary tract infections in pregnancy. Please feel free to even type out your questions in the chat box. I will be able to read them. Do we have any questions? I'm surprised nobody's asking a question about toilets and urinary tract infections. I've heard quite a lot of women present to the clinic. I used a dirty toilet. Because of that, I got a UTI. there is no correlation between using toilets and urinary tract infections. Advice that I always give our pregnant mothers is that number one, it is very, very important that you urinate as frequently as possible. Why? Because the longer you keep urine in there, and because of the changes that begin to happen in pregnancy, you find that bacteria starts to grow in that particular area. And as bacteria starts to grow, it keeps on growing and growing, and then you develop a urinary tract infection. So it's not because you went to use another toilet. It's because you, first of all, are avoiding urination. And then something that actually even worsens it is that number one, there are these changes that have happened to your body. And then number two, because you're out there and you're afraid of using a toilet out there, you decide not to hydrate. You decide not to drink water. Why? Because you're scared if you drink water, you have to use this public toilet. So now that you're dehydrated and there's urine that is staying still within your bladder, bacteria begins to enjoy living in this concentrated space, and therefore it worsens or leads to a urinary tract infection. So it is important for pregnant women to hydrate properly, drink water. When they need to pee, please pee. It is very important. And that's why even when the pregnant woman is in labor, we do encourage her to pee as frequently as possible. And the idea is that peeing and having an empty bladder also aids in the baby during the labor process for the baby to descend down the birth canal. So toilets do not lead to urinary tract infections. Do we have any questions from the people on the call? There's a comment in the chat box from Dr. Sekeleti. Thank you very much for the presentation. Dr. Musoba, please emphasize that toilets do not cause infections. Thank you very much for that. Toilets do not cause urinary tract infections. It's bad bladder habits that lead to women developing urinary tract infections. It appears there are no questions that are being posted and there are no questions in the chat. I would like to thank everybody for logging in. This was simply an education about urinary tract infections in pregnancy, which are extremely common. And the major reasons why they are common is because of the changes that the body undergoes in order to protect the baby that is growing. What foods does one has to avoid in order to prevent urinary tract infection? That is a question that is in the chat box. In terms of food that one has to avoid, of course, high salt content is not good in general. Why? Because this would lead to dehydration. Dehydration will lead to concentrated urine. Concentrated urine will lead to one developing urinary tract infections. So, salt in foods, more especially adding table salt in particular, that is not a good thing. So, that is something that is need to be avoided. But in terms of some that have a benefit in helping prevent urinary tract infections, you find that cranberries have been shown to be very useful in preventing urinary tract infections. Cranberries themselves have got a property within them that prevents bacteria from sticking to the walls of the bladder and therefore allows you to sort of excrete the bacteria and prevent these urinary tract infections. So cranberry juice, something that is very, very important. Stephanie says, I actually thought toilets contributes to UTI. Just got schooled. Thank you so much. Yeah, you're most welcome, Stephanie. And it's a very common notion and thought that a lot of people have. And the mind does play tricks. But like I said, it's a follow-up of different events that leads to that particular moment. So if there are no questions, just be reminded vaginal hygiene is very important. Hydration in pregnancy is very important. early antenatal care and routine antenatal visits are very important. There's a question from Sylvia which says, can UTIs affect the fetus? Very much so. Remember, with urinary infection, these are infections that are sitting within the bladder. Because they're sitting within the bladder and the female urethra is quite short, there's a very high chance of this bacteria migrating from the urinary system as one passes into the vaginal area. And it can end up ascending up the vaginal area and causing infections. That's number one. Number two, it can cause a systemic infection, which means it goes up through the bladder, through the ureters, to the kidneys into the blood circulation, and cause a woman to generally be unwell. And as the woman is unwell and there's this infection that has gone into her bloodstream, it can also go to the placenta and affect the baby. So, yes, untreated UTIs can complicate and affect the fetus, leading to preterm delivery, leading to miscarriages, leading to infections of the baby at delivery. There is a comment from Shekwa saying, I missed what you said about cranberry juice. Did you mention? Yes, I did mention cranberry juice. So, cranberry juice has got natural properties in it that helps with the prevention of urinary tract infections. So, it does this by certain properties that help prevent bacteria from sticking to the walls of the bladder. So, yes, cranberry juice has been shown to be helpful in preventing urinary tract infections. So, get yourself some cranberry juice, hydrate a lot. The idea is hydration, 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 but the properties in cranberry juice do help. Christine Smonza says, thank you, sir, for the presentation. Can wearing underwear pants in pregnancy for a long time also contribute to UTIs in pregnancy? Thank you for that. Underwear in itself um, is a contributing factor for most of the vaginal infections. So remember, with vaginal infections, and sometimes the proximity that is there between the vaginal area and the urination area. So this area can lead to bacteria migrating between these parts. I always say the female anatomy is very interesting and unique because of how close these particular openings all are. So because of the proximity, it means there's a very high likelihood of bacteria migrating from one area to another. So when we're talking about underwear, in particular, what one needs are these cotton underwears. Why? Because they do absorb moisture, and through absorbing moisture, they do not cause that area to be damp, thereby allowing for bacteria to grow. So underwear is useful. Cotton underwears are very important. Using of panty liners to help absorb some of these moistures and being able to change your panty liners as frequently as possible is some of the prevention measures that one can actually use. I hope I've answered your question on that. Okay, so it appears there are no more questions in the chat. I'd like to thank everybody for logging in, and I'd just like to remind everybody on the call that November is Men's Health Month. So reach out to a man out there. This is why I have not shaved the whole lot of November, where most men are not shaving in solidarity for standing for prostate cancer in particular, which is a very high cancer that is there in Zambia and high among men. So November is Men's Health Awareness Month. Thank you very much for the presentation. Baleke says, thank you for the presentation, Doc. The presentation can cranberry gummies be used for prevention? So I am not so sure about the cranberry gummies. Why? Because with cranberry gummies, they usually have additives in terms of sugar. And remember, high sugar content also predisposes one to developing urinary tract infections. And if one is taking sugar as well, this also can lead to areas of dehydration with taking sugars, thereby reducing your urine output at points. So with cranberry gummies, I am not very sure about that, but the liquid form of cranberry juice, and I know there are some products that are actually capsules of cranberry extracts that are also used as supplements to help prevent urinary tract infections. There's Beauty Michelle, thank you, Doc, for the presentation. We're learning a lot. Thank you very much, Sister Beauty. Chichi says, thank you for the presentation. Kindly also talk about care after cervical sacrilege. I feel that's a topic on its own, and I feel we'll add it to our webinars. And I think do stay tuned. We'll talk about cervical sacrilege at some point in time, the indications of cervical sacrilege, why do we get to do it, how do we get to do it, what are some of the complications of cervical sacrilege, what happens when a woman has got a sacrilege, how does she deliver. We'll get to have that discussion. So Chichi, please do stay tuned. Follow us on our Instagram, Facebook, Womb Care Clinic, and even on YouTube. Follow our YouTube channel, which is Womb Care Clinic. B says, thank you for the presentation. Learning indeed is ongoing process. And Bewa says, great presentation. So thank you everybody for logging in. Remember, this is a recorded session, so we'll share it on our channels so that you can listen to it, share it with a friend. Thank you for logging in, and I wish you all a very, very lovely week.